Respected chief guest for today's program, Jay Shilan sir, respected parents, my colleagues, and dear students, a warm good morning. It is a great honor and privilege as the principal of Hindustan College of Pharmacy to welcome one and all to the virtual inauguration and orientation session of the third B.Pharm batch of Hindustan College of Pharmacy, Kottayam. We at Hindustan College of Pharmacy is committed to a quality education and extend a warm welcome to all the newly joined students to this noble profession. And I congratulate all the parents and students for choosing this pharmacy profession at Hindustan College of Pharmacy. On this great day, now I have the duty of welcoming all the chief guests and respected parents and students. Now I welcome the chief guest, Sri Jay Shilan sir, a great entrepreneur who started his career in pharmacy profession and reached to greater heights. And on behalf of the management and faculty and parents and students of the Hindustan College of Pharmacy, a very warm welcome to you, sir, who has accepted our invitation and given a consent to share his valuable time with us. Thank you, sir, and a warm welcome to you, sir. And we welcome all the respected parents and all the students who has joined in this institution, and a warm welcome to all the students and my colleagues to this inaugural program. Now I take this opportunity to read a short profile of our inaugurating dignitary, Sir Jay Shilan sir. He has completed his schooling in government school in hometown Salem and later was accepted into the prestigious Madras Medical College through merit for completing his 4 years Bachelor of Pharmacy degree. He has completed postgraduate diploma in marketing management and MBA in marketing. He began his career in pharmaceutical sales and marketing at Torrent Pharmaceuticals Limited in 1989 as a medical representative and got promoted in 1992 as a first-line manager. In 1993, he launched Eli Lilly as a sales manager in the Tamil Nadu, based at Coimbatore. He was then taken by Sun Pharmaceuticals in 1994 as regional manager in charge of the entire state, where he was one of the top contributors for the growth of the company. In 1997, he became the zonal sales manager in RPG Life Science, in charge of the entire South Zone. In August 1999, he became an entrepreneur by starting a pharmaceutical marketing company. Today, he is a promoter and director of following companies: Murray Chemicals Private Limited, a US FDA-approved API bulk drug company; Hybro Healthcare Private Limited, manufacturing of finished formulations for US market; Saimira Inopharm Private Limited, manufacturing of finished formulations; Invents Life Science, FMCG marketing; Delvin Formulations Private Limited, a domestic formulation marketing. He also has various affiliates as a chairman of the Indian Drug Manufacturers Association, Tamil Nadu, Puducherry, and Kerala. He is the National Vice President, Industrial Pharmaceutical Association, Industry Division. He is the President of the Tamil Nadu State Pharmacy Council. He is the Vice President, South Indo-American Chamber of Commerce. We have a lot of applause to Sir because it's a source of great inspiration that he has started his career as a B.Pharm graduate and has become to a greater heights as a great entrepreneur, which is a great source of inspiration to all our students who has joined the B.Pharm course in our institution. Now, I welcome Sir to officially inaugurate the program and also bless the newly joined students. Sir, you can take over, sir.
Good morning, all respected founder and promoters of Hindustan College of Pharmacy, Principal Dr. Sujit and other faculties of Hindustan College of Pharmacy, parents who are also attending this program along with their kids, and all fresh future pharmacists who are attending to this program. A warm welcome to all of you. I'm very happy to interact with you. That too, you are all from the country, that is state, and that to a wonderful place called most lovable place for me personally is kottayam, which I visit also. The only thing is we are meeting virtually. I would be happy to visit kottayam and directly with you when you are coming in our final year. Because more than talking or speaking from one side, interacting with you would be more useful for both of us. But at this juncture, as an inaugural program or orientation program, most of you, I believe, would not understand fully the potential of pharmacy. And somehow you want to come into health line, you would have chosen pharmacy. So my main objective for next 10 minutes or 10 to 15 minutes is just to highlight what is pharmacy profession, what is uniqueness, and how it is superior or better than any other profession. As Dr. Sujit, while explaining my biodata or my career, multiple times pointed out that I started as a pharmacist. Yeah, I started, I preferred, I got engineering, but I chosen pharmacy and I joined pharmacy and I studied in pharmacy. Later I grew by God's grace, and of course, the opportunities thrown in front of a pharmacist in pharmacy profession is tremendous. I choose marketing line, which need not be for everybody because there are multiple scopes in pharmacy. Before going into the scopes of pharmacy, as young students here, I want you to understand what is the significance of pharmacy course or pharmacy. The best example would be last week news, if you have seen some 4 or 5 days before, you have seen our country's Prime Minister visited 3 pharmaceutical industry in single day. A Prime Minister visiting to a pharmaceutical industry understands the significance of pharmacy. It is not that pharmacy industry people visited the Prime Minister. You just understand, you all know, you would have seen the news. Our Prime Minister want to understand the position of or the timeline of getting vaccines for this COVID pandemic. And he was so curious that he need to directly visit and interact with the scientists and our people there. Okay, just understand this one incident, which is a fact very recently happened, helps or it is explaining why pharmacy is important. Just another thought in your mind, Kerala, you all know, one of the state, of course, early you got pandemic issue in Kerala. But you just recall, across India, not only across India, across the world, when this pandemic is happening, we have seen most of the doctors did not go for the practice. Most of the clinics and hospitals, they closed. Only COVID treating hospitals, some government hospitals and government supported initiatives, and few doctors are working. So when you are talking health, we are all normally, as a social normal person, we always remember doctor because we are first going and explaining our problem to doctor. Nothing wrong about it, and he diagnoses the problem and he is giving you medicines. But here, in this pandemic situation, I want to tell you, across the globe, no pharmacy was closed even a single day. So medicine is so important. Medicine is like the root of a tree. The fruit is health, other health professionals like doctor, nurses, who directly you are getting and you are getting treated. But the root of the tree is medicine, because without drugs, you cannot treat any disease. Without doctor, you can treat few diseases, headache, fever, some pain, respiratory infection. Without doctor, you are getting medicine, you are getting cured. But doctor also can cure a person only with the use of medicines or drugs. Then you should understand what is the significance of a pharmacist there. Pharmacists are the drug experts. You are all very young kids. Keep in your mind, when you are entering into this profession, love this profession, because pharmacy is a person who is the drug expert, who is involved right from the research and development, right from the invention of a drug, research and development, formulating into a tablet, manufacturing, quality control, quality assurance, regulatory and approving the drugs, finally marketing of the drugs, and ultimately dispensing the medicine into the pharmacy people. Right from the birth of the medicine to the final dispensing of medicine, a pharmacist role is there. If I can list down, I can tell you around 26 different field is available for a pharmacy profession. No other degree. For example, BE mechanical means you will go into mechanical, finally you are coming into IT, that is different. Any other profession, you don't have this many options. That is also one strength and that is a problem, because most of the pharmacists doesn't finalize which line you want to go, and you will get struck, and that time your teachers will help. Ideally, when you are reaching your third year, you need to finalize whether you want to go into R&D. If you want to go into R&D, definitely you need to study a pharm or if possible PhD also. So if you want to go into a pharmacist work in abroad, in Gulf or something, even B pharm with some experience in some hospital. If you want to come into manufacturing, B pharm will be sufficient. Marketing, B pharm will be sufficient. Let us some MBA you can do side. Similarly, suppose you are going into quality control, analytical R&D, QA, you can do MPharm. So what I'm trying to tell is, when you reach third year, you need to arrive what is that you want to do, because the opportunity for you is tremendous. There is no single work for you. So you don't think after finishing B pharm, most of the parents used to ask me whether there will be a college final, when they are into final, whether there will be a campus interview, whether they will get a job. See, pharmacy is a profession. Please understand. Pharmacy is a profession. Medical doctor is a profession. Nurse is a profession. Lawyer is a profession. So there is a no, see, campus interview would be always there, but that is not going to the limitation factor. That is not going to decide your future. What is more important is, as young pharmacists, when you are coming in, believe this is the best course available for you. You are the expert. See, when I said right from the invention of medicine till the dispensing of medicine to a patient, pharmacist role is there. That is a significance. Prime Minister is visiting a pharmaceutical industry. Today, the entire world is looking pharmaceutical industry, because pharmacy profession were not so much in limelight. Now, the entire world, right from US to everywhere, they are looking for medicines. They are looking for vaccines, how to get out of these things. Everybody is not looking doctors, not nurses, not other health professionals. They are looking for pharmaceutical company to give solution. Who will give solution in pharmaceutical company? It's pharmacist. Without a pharmacist license, you cannot start a pharmaceutical company. If I have a manufacturing company, I need minimum three pharmacists there. One in QC, one in production, one in quality assurance. 3 people are needed to start a factory. To start a pharmacy, medical shop, you need a diploma in pharmacy, minimum certificate. So what I'm trying to tell is, it is not going to give you a job. It is going to give you a way for your career. There is a difference between job and career. So it's a professional career, which young people like you put it in your mind. You are in a very good, well-defined, wonderful course you have joined today. And you have joined in a wonderful college, which is giving a lot of importance to pharmacy profession, because it's an exclusive college for you, and good, teachers and lecturers are there. Take their help and try to build, try to create your own path as a professional pharmacist career. It will definitely fetch you good result. Right from the manufacturing, if you want to come into the industry, in industry, you have 10 scopes, different scopes. You want to go into government? Yeah, government scope is drug inspector is there, drug testing laboratory is there, and government pharmacists are there. Too many scope is there. So what I'm trying to tell you is, believe that this is a very good course. And we all know that pharmacists are the person who are responsible of manufacturing or marketing or dispensing of any drugs. And normally we used to tell drugs cannot be sold. It has to be dispensed. There is a difference. See, it is not like a commodity. You go to a shop and get medicines and come. No, the role of pharmacist is there. The pharmacist is the only person knows when their drug should be taken, whether it should be taken before food or after food. Whether suppose your parents are taking some 5-6 drugs, doctor doesn't study these things, interactions. Only a pharmacist knows. So once you are completing, you will understand which medicine to be given along, which should not be given. Drug to drug interaction will be there. Drug with food interaction will be there. And just for your kind information, I want to share, even today in United States, so such a superpower country, there itself, the third vital reason for death of people is medicines and doctors, which means the irrational use of medicines and doctors is the third reason of death in US. Then think what would be first in India, because the role of absence of pharmacists in a normally a doctor cannot just like that give medicine patient take. There should be intervention of pharmacist who has to guide. In US and all, just for your information, young persons, I want to tell you, the prescription does not go to the patient. Here, you are going to a hospital, you are getting the prescription in your hand, you are going to a pharmacy and getting it. In US or UK, Japan, all these places, regulatory countries, how it works is the prescription directly goes to the pharmacy where you want to buy. It doesn't, they don't give in your hand. When the prescription goes to the pharmacist there with the prescription. And if there is a controversy in the drugs, what is being prescribed, he go back to the doctor and tell, you cannot give to this asthmatic patient this third and fourth drug together. Then doctor changes the prescription. So in US and all, any problem in the medicine, because of medicine, the first case comes to the pharmacist, not to the doctor. Because the prescription is vetted by a pharmacist, it is handed over to the patient. This is the scenario. So friends, colleagues and students, young people, some of you would like to want to do MBBS and you did not get the mark, or your situations of financial things may not be suitable. So by default, you would have come here. But I want to tell you, children, that you have come to a place where your worthiness, your talents can do better than an MBBS. If you have become a doctor, you can treat, say, daily 20 patients, 30 patients. That's all. But being a pharmacist, the medicine what you produce will cure lakhs and lakhs of people. So on this first day of college entry, inspire yourself that it is not a job I am looking for, not some job I'll go and settle in. It's a very good profession my parents have put in, and I will definitely explore this opportunity. I will learn very well. I'll do something. No, you are part of this pandemic. We are almost 1 year is over. Last December, this COVID started, and still medicine is not coming for the cure. Who is responsible for it? Only a pharmacist can invent a medicine. So as future pharmacists, you will get more and more diseases to come in, more and more health challenges to come in. You only can find a solution for all those things. So my request is, being a first day of your college and you are listening to a fellow pharmacist, please remember, put this hardly into your mind that you will do something for this community, and you will definitely do something in the pharmacy profession which will make your parents proud. Okay, so remember, pharmacy profession is a profession which is having a wonderful thing, and if any time you want to come into the industry, always industry people are short of pharmacy people. And I don't know how many of you know. I just want to tell you, friends, you have seen at least 6 months before, the president of US called our prime minister, Trump called our prime minister and asked for medicines. Hydroxychloroquine we want, please send. You know why? India is the pharmacy of the world. India is the pharmacy of the world, because from India, we are exporting medicines to over 200 countries. Any country in the atlas you touch, our medicines are there. From India, no other commodity, product or service is going to this many countries. IT, information technology, is going only to 95 countries, where only English speaking countries, not to Spanish or Japan or those places. So what I'm trying to tell, India is the pharmacy of the world because, and India is in value, India is number 3 in the world. Production wise, also we are number 3. In value wise, we are at number 11 because the cost of the medicine in India is the lowest in the world. We are giving, no country can produce medicine, including China, lesser than our cost. That is why see, it's not just exporting medicine and earning money. It is about saving of trillions and trillions of life. India is exporting over to 200 countries, means it's not only that we are getting money, we are treating so many people. And friends, colleagues, I want to tell you, today these vaccination things are happening. You should know, today, out of 2 vaccines produced in the world, entire world, out of 2, 1 vaccine is produced in India. Without it, whoever can invent vaccine, but who is having the manufacturing capacity is India. Without producing in India, you cannot feed the vaccines to the world. Every 2 vaccines, 1 is made from India. Today, US FDA is a gold standard, right? In US FDA, apart from US, the number 1 country which is doing business with US is India. 40% of the generic drugs used in US is manufactured in India. The common public, parents may not know this. You have put your children into a right profession, because in today, if you think US is the superpower, Japan is the superpower, all these countries are depending India only for medicines. Nothing more they want from India. Please remember, they can live on their own. But if today India stops medicines to US, they cannot survive, because 40% of their medicine are from Indian companies. So silently, without going into publicity, Indian pharma industry has done so much good for the country and the profession. You tell me, when the entire world is depending for India for medicines, and when you all joined in a pharmacy profession, you tell me which profession would be better than this. If you have gone to IT, your scope is limited compared with the pharmacy profession. This many countries are depending on you. So you are, once again, I want to tell from the industry side also, that is why India is called as the pharmacy of the world. India is not we are calling, the world is calling. Because many countries, African countries and all, cannot survive even one day without Indian medicine, because they don't have manufacturing factory also. All medicines required for them is going from India. China is good at chemicals, bulk drugs. See, in formulation, you know, there would be a bulk drug company which will produce in bulk. Paracetamol means paracetamol bulk. Later, it will be converted into tablet. When it is converted into tablet, there is a touch of pharmacy student. Okay. So now in formulation, that is when making tablet, liquid, injection, India is number 1. Bulk drug, China is doing well. We are also doing well, but China is doing well. But even there, China could not compete with us in formulation. China is not exporting to over 200 countries. Nobody wants China's medicine. They want Indian medicine. Just for your information, multiple times, Indian government has seized drugs exported from China. They have put a label of made in India, because they could not sell. They put made in India and they have sold the drugs, and international police has acted on all those things. Just for information and sharing this. So colleagues, friends, students, I would like to once again insist, once again reinforce, once again confirm, and you are joined into a wonderful course. Don't have any negative thoughts on it. The opportunity is tremendous. You want to do something worthwhile in healthcare profession, you are into a right profession, because no other profession, I don't know whether you know, a doctor cannot run a pharmacy without a pharmacist. Doctor cannot, as per rule, doctor is not supposed to dispense medicine to patient. Only a pharmacist should give medicine to the patient. And patient sees pharmacist multiple times than a doctor. A doctor gives only 5 minutes to a patient. But that patient buys, if he's a diabetic cardiac, he goes to pharmacy and buys medicine every 15 days. So the scope of interacting with the pharmacists are more. So in any direction you see, whether it is industry, whether it is a pharmacy, community pharmacy, hospital pharmacy, regulatory, any side you see, the scope of pharmacy is tremendous. Okay, so I once again want to wish all of you, the young birds, the future pharmacists. We'll have multiple interactions. And if at all you have any question to ask, I'm ready to answer. I don't know whether it is part of agenda or not, but some parents or somebody want to ask something, I'm here to answer. But before signing off, I once again wish every student who is attended here, could not attend due to some reason also, for a prosperous and a good growth in pharmacy. Thank you all.
Thank you, sir. Thank you for your inspirational speech to all of us newly joined BPharm students. Thank you for accepting our invitation in spite of your busy schedule. And we also invite you to be present in our institution and in your later time. We'll be happy to have your presence here. Thank you for the virtual presence today, sir. On behalf of the management, faculty, parents, and students of Hindustan College of Pharmacy, we thank you for your valuable talk. Thank you, sir.